Hello, thank you for taking the time to come to my presentation on coordination of care. My name is Crystal and I'm a registered nurse at Inova Medical Center. Today I will discuss care coordination and the collaboration strategies with patients and their families. I will review some aspects of change management and how it affects the patient experience. I will discuss how ethical decision making is incorporated into the coordination of care. I'll go over some specific policies that have impacted care coordination. And lastly, I will explain the nurse's role in the continuum of care coordination. Care coordination is intentionally preparing and sharing patient care activities with the patient healthcare team and families to provide safe, effective care. AHRQ 2018. Care coordination starts when a patient is admitted to the hospital or seen in an outpatient setting. The patient is involved in their care planning by including them in open communication about their health needs and preferences, so the patient receives appropriate, effective, and safe care. The interdisciplinary team must communicate well and effectively to provide quality patient-centered care. Nurses coordinate care daily by setting up appointments and various consultations, approving prescriptions, and educating our patients. We'll talk about the strategies used to achieve desired patient care outcomes. When coordinating care, including the patient and their family members or the party responsible for caring for them after they go home, is essential. Clear and concise communication ensures everyone is on the same page. Avoid using complicated medical terminology. Allow for questioning and teach back for understanding from the patients and their caretakers. The teach back method is a strategy that tests the knowledge of the patient and their family by asking them to show how to do a task or by asking them to explain in their own words the importance of adhering to the care plan or medication administration. The teach back method confirms that you have explained the aspects of their care plan in a clear way that everyone can understand. AHRQ 2018. Active listening is another strategy related to good communication that helps provide patient-centered care and builds rapport. Active listening includes listening to and addressing any questions or concerns the patients and their family members may have to build trust. Studies have shown by Freelik ATL 2020 that when patients are treated by a physician they trust and are familiar with, they are more likely to comply with the self-management plan. We must also remember some of the communication barriers that may come up during care coordination. Some obstacles include readiness, cultural differences, and the lack of understanding. Cultural competencies is important for patient compliance, so each care plan is tailored for each patient. The nurse must listen and ask questions if the patient has concerns about following the care plan at home. For example, different cultures have different diets, so a patient is less likely to follow a meal plan that does not line up with their cultural diet. Creating a meal plan or food list that complies with their culture and health is a win for everyone. According to Wiglian ETL 2018, it's important to not just extract data from patients, but to give the knowledge that will benefit them, and the community is an important ethical consideration. Another helpful strategy in creating positive outcomes for the patient and their families is utilizing nurse navigators. Nurse navigators assess patients' needs, help minimize barriers to care, and provide any local or national resources needed. They also must communicate with different interpersonal team members, schedule follow-up appointments, and handle insurance issues. When communicating with patients, make sure to also include your nurse navigators to serve your patients better and to move the care along. Next, we'll talk about the change management that affects the patient experience. The healthcare field is constantly changing, and healthcare workers must adapt to the changes while helping patients and their families adapt. Patients' healthcare needs vary from patient to patient throughout their lives, depending on the disease process or progression. Change management will help ensure the change is implemented for quality care coordination. The curve change model is a great model to utilize during the many changes that come our way in healthcare and has 4 stages. The first stage is called the state of status quo, which involves the patient's shock and denial. Capella 2022. During this stage, the nurse should educate the patient about the new process or disease to help them accept or process the new information. Disruption is the second stage, where the patient reacts to the changes with fear or protest. Everyone has different fears involving change, and if they're not managed well, this stage can turn into something called the danger zone, where the new information can feel chaotic. The nurse must listen to and validate the patient's concerns or reactions. Capella 2022. The third stage is acceptance, where fear and reservations are finally accepted. The patient lets go to accept the change or news. The patient processes the new information and the changes needed, weighing the pros and cons to move forward. The nurse can now educate the patient and answer questions. Capella 2022. The final stage in the model is rebuilding, where the plan is created and the patient commits to the plan and starts making the necessary changes. During this time, nurses should engage and praise the efforts of new changes since it builds confidence and trust. Capella 2022. I will now go over the coordination care plans based on ethical decision making. Nurses will encounter many ethical dilemmas when caring for patients during care coordination. This is where the Code of Ethics, created by the American Nurses Association, guides nurses in making ethical decisions throughout their practice. The Code of Ethics has 4 principles, and they are autonomy, beneficence, non-maleficence, and justice. Capella 2020. Including patients in their care coordination plan makes them more likely to follow it, giving them autonomy and control of their health. Justice is incorporated by creating patient-centered care, incorporating a patient's culture, religion, sex, and age. Beneficence and non-maleficence are practiced by listening to a patient's health concerns and questions, and staying current on the most current evidence-based practice to provide appropriate care to each patient. Now we'll talk about the impact of healthcare policy on the patient-centered care. Healthcare and insurance coverage is costly, especially when someone cannot work. In March 2010, President Obama enacted the Affordable Care Act, which helps provide people to access to healthcare, improved healthcare, patient healthcare outcomes, and experience. The 3 main categories of the ACA are 1. Making health insurance affordable and available to the public. 2. Expanding Medicaid so adults with an income below the 138th percentile of poverty level are covered. And 3. Implementing more efficient and innovative medical care to help lower healthcare costs overall. Wheel 2020. As a result of these policy changes, patients have better access to healthcare, lower costs, and a better quality of life. I'll now talk about the vital role nurses have in care coordination, which is my last topic. So we'll discuss the nurse's role in care coordination and how vital in all healthcare settings it is to ensure in the continuum of care. Nurses must utilize effective communication with patients and their family members, all as interdisciplinary team members, to ensure success of the care plan. Patient education starts during the patient admission process and continuing until the discharge teaching is also vital to the care coordination. Advocating for each patient's preferences and needs despite what their family or we as nurses think the patient needs is important in care coordination. The nurses coordinate care by providing information on additional resources available when they go home to implement the care plan. The nurse is a vital player in the care coordination that can either make or break the patient's healthcare experience. This concludes my presentation. I reviewed the strategies for working with patients and their families and how change management affects patient-centered care and enhances the patient's experience, how ethical decision-making is included in care coordination, and how policy provisions influence the patient experience. I talked about the nurse's vital role in the coordination and continuum of care. So I hope this presentation helped inspire you to create effective patient-centered care plans when you coordinate patient care, and to show you the importance of the nurse's role in care coordination. Thank you.